Megan Ferrier-Nolan and the PreHealth advising team here. And then we also have Dr. Egan, who I mentioned at our very first meeting and has now joined us. So maybe we can get a couple minutes for you to introduce yourself to Dr. Egan before we get into everything, if you'd like, just to let people know why you're here.
I'll just be real quick. So I'm Dr. Egan. I'm in the chemistry department. I run a drug discovery lab. I've had a lot of AMSA presidents and officers come through. So they've kind of eventually roped me into being an advisor, which is my pleasure. Everything is done by your officers. I don't do any work. So, but if you ever want to talk to me about medical related careers outside of the MD track, like drug discovery, then please come see me. Otherwise, thank you for inviting me, Emily. I appreciate it.
Awesome. Thanks for coming. So we can get started with a couple announcements. It's 11:10 right now. So we've been announcing this for a couple of weeks now, but it's actually this weekend. So the UC Davis PreHealth Conference is this Saturday, and it is in an online format. And as we mentioned before, it's free this year due to the online format. Oops. So it's a really great opportunity for everyone to see what's out there as far as medical schools and connecting with schools and other med school related companies and things. Kaplan does some stuff there. Yeah, so there's a lot for you there, and it's free. So great opportunity. People still asking to join, so I'm letting them in. Alrighty, and is this you, Julia?
Yeah, this is me. So just real quick, this is a program that Campus Health and Wellbeing is putting on. There's one being put on this weekend and then next weekend. So if anyone's planning on attending the UC conference, you can always sign up for next weekend. Basically, it's called Sky Happiness, and it used to be a full weekend long retreat, but they've sort of condensed it into 3 hours over 3 days kind of workshop. So if anyone's interested in learning about meditation, mindfulness, kind of breathing exercises, stress reduction, all of that, this is a really cool opportunity. It's also free. Campus Health and Wellbeing is paying for all of it. So you can register. You do have to register. There's a form if you follow the @MyCPWell Instagram. The form's in their bio. You can also find it linked on the Campus Health and Wellbeing page under their calendar of events. So yeah, just really cool opportunity for anyone who's interested in learning some of this cool stuff.
Awesome. And then I think Claudia's here.
Yeah, I'm here.
Awesome. Do you want to remind everyone?
Sure. I know we very briefly explained it last week, but we are holding a fundraiser. All the money that we get is going to go to 40 Prado, and that's one of the homeless shelters here in town. It's open to all AMSA students and to their extended families. We're also open to donations, and we are raffling off spooky baskets. So there's 3 baskets, and as you can see, they have AMSA t-shirts. Those are some of the t-shirts from past years. And then we have different sizes, of course. There's coffee tumblers, face masks, candy, and other cool stuff. And then we're getting 5 winners. So 3 spooky baskets, and then the other 2 winners will just get some t-shirts. And if anybody has any questions, they can text or email us. The Venmo, you Venmo Gwyneth, who's our treasurer. Yeah.
Awesome. I think that's all of our announcements for the day. So we can pass it over to you and your team, Megan. And I'll stop sharing my screen so you can share yours.
All right, so Connor is going to share our PowerPoint while he's pulling that up. I will just introduce myself and Connor and Jacqueline, and they'll introduce themselves as well in a second. So my name is Megan, and I am one of the advisors in the College of Science and Math Advising Center. In our office, we see students from our college who have majors in the College of Science and Math, but we also see students who are pre-health in other majors. So if you're not a College of Science and Math major, I mean, it is very common for students to be biology majors in pre-med, but it's not required, as I know you guys have probably talked about in your AMSA meetings, but we see students from any major. So, and then Connor and Jacqueline are peer advisors, and I'll let them introduce themselves and tell them a little bit more about who they are.
Hi everyone, my name is Jacqueline and I'm one of the peer advisors like Megan said, and I'm a 4th year pre-optometry student and my major is biology.
Hi everyone, my name is Connor Hatfield. I'm the other pre-health peer advisor and I'm a 5th year liberal arts and engineering studies major and I'm pre-med.
Okay, so in our office, we have other advisors as well. If you are a new transfer student, or if you are in your 3rd or 4th year at Cal Poly, you'll want to meet with one of our staff advisors. So myself, Anya, Christy, and Laura. And then Emily is our new graduate intern. And she doesn't really do much pre-health advising, but if you are one of the science and math majors, she can help you with course planning. The way that we structure things in our office is we have the peer advisors, Jacqueline and Connor. We typically have 3 peer advisors, but because of COVID, I wasn't in a place to be hiring someone. Anyways, the peer advisors will meet with students who are in the early stages of planning for a career in medicine. So when you're in your 1st year, 2nd year, basically before you take the MCAT, you'll want to be working with Jacqueline and Connor or whoever the peer advisors are next year. They will help you with planning your classes if you have questions about that, your prerequisite classes, your major classes. You'll want to work with an advisor from your major department. So if you're in our college, you'll want to work with one of us, but if you are not in our college, then you'll want to work with the advisor from your college. So if you're like a psychology major, you want to work with the psychology or College of Liberal Arts major advising center. Or business or engineering, for example, because we are not familiar with the classes from those other majors. So you'll want to have a couple of advisors. Connor and Jacqueline you'll work with as far as planning prerequisites, and then a big chunk of what they will help and support you with is finding experiences. So AMSA does a lot of advertising of experiences, and we do as well. So we're just another resource for that. We have a blog and a Canvas page, which we'll go over, that you can access to find out about those things. And also just talking to Jacqueline and Connor about, like, if you're unsure of what you want to do or unsure of what you're going to do, unsure of what the options are, if you're weighing 2 different experiences and just want a sounding board, Jacqueline and Connor are great resources for that. Even though Jacqueline is not a pre-med student, being pre-optometry is quite similar as far as the planning stuff. She just doesn't take the MCAT. She takes a different exam and applies to different schools. But as far as the preparation goes, it's very much the same for optometry and medicine. So she can definitely support you and help you navigate those decisions. Once it comes to taking the exam, then you'd want to work with one of our staff advisors. And our staff advisors will help you to determine when you're going to be most competitive, and if you're competitive yet, and more things you need to do in order to become competitive. If you take an MCAT and you're not happy with your score and you're unsure of what your next steps should be, that's when you'd want to talk to one of the staff advisors. And then also things like your personal statement and just like, you're ready to apply, now what do you do? There's so much to the application. We support you through that as well. So that's kind of the basic structure and timeline of who you meet with when. But the short end of it is, for now, you'll probably want to meet with Jacqueline and Connor to go over class planning and experiences.
And yeah, so Megan already mentioned we do have a Canvas page. This is not like the ones for your courses where you have assignments or anything. It's just resources for you to go through on your own. So a lot of the information on here is pretty similar to our website, but we also have some additional information that we just don't want to have public to everybody. So things like interview feedback from alumni or students who have done interviews at various schools, some additional personal statement resources and stuff for entrance exams, as well as the application process. So if you're not already on this Canvas page, all you have to do is email us at prehealth@calpoly.edu. We'll also have that at the end of the presentation if you want to just jot it down, and just request access to the page and we'll add you to it. So it's super easy.
So I'm going to talk about the PreHealth website briefly. And so right now what you're seeing is the medicine career profile page. And we'll go into more detail on that in a second. But first, I just want to encourage any of you who haven't already spent some time browsing through the PreHealth website to do so. We have lots of great information and resources on there. On the different tabs, we have experiences that you can get connected to. We have information about the application process, how to prepare for interviews, how to write your personal statement and what committees you're looking for, and just lots of other great information. So I would encourage you to spend some time doing that if you can. And so, like I said, what you're looking at here is the medicine career profile. And so on here, we have a general summary of what a career medicine is, which I'm sure most of you are very familiar with. We have a summary of education and training. So 4 years of med school plus anywhere from 3 to 7 years of residency and then fellowship. A list of schools in California, links to professional associations, and then this Cal Poly Alumni Medicine tab is really cool. This has letters from Cal Poly alumni that are either in med school or in residency, and they talk a little bit about their experiences, and most of them include their contact info. So if you want to reach out and email them or text them and ask some questions about their particular school or their Cal Poly experience, their interview experience, or just what being a medical student is like, that's all there for you and available. So I encourage you to take advantage of that. And one more thing I was going to say about the prerequisites. We just want to note that our list is a pretty comprehensive list of the prerequisite requirements, and they should meet the requirements for most of the schools in California in the US, but definitely do your own research as far as what schools require what classes. Some schools will have unique, like they may require calculus for some reason or an extra biochemistry class. And so we can't cover all of those differences, but our list here is a good place to start. But when you go to apply, just make sure that you're checking all those boxes before you spend the time and money on the application. So.
And so a little bit more on the prerequisites, like Connor was saying, most of them are pretty straightforward, but math tends to be one that we get a lot of questions about. And so I'm just going to start with the bullet point on the bottom, because that's honestly the most important one on this slide, is that requirements for math vary a lot by different schools. So you really need to check with any of the schools that you're applying to see what they require, if they require math, and if they do, if they accept AP credit, or if they require you to take those courses at Cal Poly. So a lot of times you'll need to do 1 to 2 quarters, and that can be usually a mix between statistics and or calculus. I know Connor mentioned some schools do require specifically calculus, so that's where it comes down to you needing to do some of that research on your own and just really looking into the schools that you are thinking of applying to. But in general, statistics is often preferred just because of the prevalence in some of like the medical journals and things like that. It's really common in the profession. So we have listed just some of the general stats and calculus classes that you may want to take. So starting with stats, 217 and 218 is just the same course based off of what major you're in. And then sometimes people will choose to go on and take 313, or if you have AP credit in 217 or 218, sometimes 313 can be a good option to show that next level. And then we also have the stats for business students listed as well. And then same with math. So there's some, I think 118 and 119 are a little bit lower level, like trigonometry, but then we have the 2 calculus series listed. Again, those just vary by major. So check with your major requirements. Oftentimes students will actually get their math quarters done just by nature of needing them to graduate either way. And then the last one we have is also for if you're a business student or taking business calc, that would count as well. So if you have any questions when you're getting to this stage, feel free to come chat with us once you've done some research and kind of know what classes you even need to take based off of the schools, and we're happy to help you with that. And so this is another page on our website that is super important for pre-health students. This is the experiences page. So just to talk briefly about it, there's the 4 main experiences that pre-health students want to fulfill during their undergraduate time. And I'm just going to go in order of the ones that we have listed here on the left. So leadership is the first one. And something important to point about this is that it can really be anything. It doesn't have to be leadership in like a club. Like you don't have to be the president of AMSA, but that is an awesome experience. If that is something you do, you can totally just be like the captain of a sports team or an intramural team, or it can be through Greek life or something like that. So there's a lot of options and you don't have to be limited to anything like that. And so our next one that we have is community service. And again, this doesn't have to be health related. It's just really showing the passion for service because healthcare is a service-based profession. And something I like to point out about this one is that it's definitely better to have quality service over quantity. You don't want to have a ton of hours at random places that you have no like personal relationships at. It's better to pick a couple organizations that you can really devote your time to and get to know some of the individuals that work there as well. And then research is another one. So this can look different and the timeline varies by student, but that's just a good experience to have before applying to medical schools as well. And the last thing we have listed here is health-related experiences. So that often can be shadowing or informational interviewing right now during the pandemic, since it's kind of hard to get in-person shadowing. This can also look like a position or something like that. Like if you wanted to become an EMT, that would definitely count for health-related experiences. And another thing that's just really important on this page of our website is the reflecting on experiences tab, because oftentimes like this is what you're going to be writing about when you do your personal statement, and when even during your interviews, you want to really be able to show how those experiences have impacted you. It's more than just writing it down on your resume, but it's really about how that's shaped you and impacted what you want to do in medicine or for your career. So I definitely recommend just checking out some of these tabs on our website if you haven't already read them, just to get a better idea for how to use your experiences and really grow from them.
Okay, and so we just briefly wanted to discuss the difference between allopathic and osteopathic medicine. And I would guess that a lot of you are already familiar with this, but we just want to cover it. So allopathic medicine is what you most likely think of when you think of a physician. It's the classic MD degree. Allopathic physicians, the general philosophy is that they focus on the biological and physiological causes and treatments of the disease. So they think about what is physiologically or structurally wrong with this patient and how can I use medicine or surgery to treat them. And it's kind of like the foundation of modern Western medicine. And then osteopathic medicine is a younger, newer approach to medicine. It takes more of a whole person approach and considers more of the psychological and social influences on the patient. And so both versions of, or both programs go through the same biomedical science classes. So there's no difference in the education. Really the only difference is that osteopathic physicians and medical students go through additional training in osteopathic manipulation, which is essentially just manipulation of the spine or bones to treat diseases like musculoskeletal problems or neurological problems. So that's really the only factor or difference between the two. And both types of physicians can go into any specialty. You're not pigeonholed into anything just because you choose one of the two. Osteopathic is typically associated with primary care, just because that's what the training is really suited for. That whole person approach and really considering lifestyle and their built environment and social influences fits very well in primary care. But if you wanted to go into orthopedic surgery or neurosurgery as an osteopathic medical student, you can definitely do that. Nothing is stopping you from doing that. And the two professions are becoming much more integrated as time goes on. And I also want to note that just because you complete training in one of these programs doesn't mean you have to practice that way necessarily. So for example, a lot of allopathic physicians take very holistic approaches to medicine and to their patient care. So just because you're an allopathic physician doesn't mean you can't consider the whole patient and think about nutrition or lifestyle in your treatment. And let's see, I think, okay, so yeah, sorry. And really, like, what we want to emphasize too is that all that matters is that you find the program or school that really is right for you, and ultimately picking the philosophy that matches you the best. So you shouldn't feel like you have to pick one or one is better than the other. Just go with whichever one is a better fit for you and your principles and values in terms of patient care. So. And Jacqueline and I in our office runs a PreHealth blog also. And so this is a great resource for you all to stay up to date on different PreHealth opportunities. So we post job opportunities, research opportunities. We share books and articles related to healthcare. We have info about upcoming workshops and events from our office. And this is just a great way to stay up to date on what's being offered on campus and in the community. And if you scan that QR code in the lower right, that will take you to the homepage of our blog. And if you want, you can subscribe. And if you subscribe, you'll get nightly email updates of what we posted that day, but it's totally optional and up to you. So.
We also just wanted to take a minute to talk a little bit about how COVID-19 has affected classes and prerequisites. So starting with virtual labs, those in the past, obviously virtual labs have not been accepted by programs, but due to the nature of the pandemic that we're in, that's going to be okay. Pretty much all the schools out there will be accepting of virtual labs during this time. So just keep an eye if things progress, because that might change if we end up going back in person, but up through where we're at currently, virtual labs will be fine. And then for credit, no credit, we are highly recommending that students take prerequisite courses for a grade. So any course on the website listed under the prerequisite courses, those should be taken for a grade if you can, because even though some programs are okay with credit, no credit, they may prefer that you take it for a grade if you have the option, which we do as Cal Poly students. And so on the right, there's a little thing you can scan just to learn more about getting experiences during the pandemic, because it's obviously challenging to get some of those experiences, like working with patients and stuff like that. But that doesn't mean that you need to do nothing, because there's other things that are out there, and like virtual volunteering opportunities and stuff like that. So this is just a great way to start thinking outside of the box.
Yeah, and Megan covered a lot of this information at the beginning, but just to go over it one more time. So the peer advisors, we typically meet with first and second year or newly pre-health students, and we just handle the general pre-health advising questions. So course planning, health experiences, referrals to different opportunities, and we can also add you to the Canvas page. If you're struggling in courses, or you just want to talk about your career path, if you're not sure what you want to do, or you're worried about your GPA, any of that stuff, we're happy to help you with. So we're just a pretty much general resource, and we operate through drop-in hours. So we have drop-in hours every weekday. And so you will find on our website on the Contact Us tab, you will find our hours and also the link to join our meeting room. And then, like Megan said, staff advisors are more for after you've taken your MCAT and you've completed your prerequisites, and they can help you with assessing your readiness to apply and how competitive you are. They can help you review and fill out your application. They can help you brainstorm, develop, and edit your personal statement. They can help you prepare for interviews. And our office in the past has offered mock MMIs, or multiple mini interviews. And I'm not 100% sure on how we're going to keep doing that, or if we're going to be able to do that in a virtual format. But essentially, those are a great way to practice. A lot of schools do MMIs, and it's like essentially different scenarios that may come up. And so they may simulate like a patient's upset with you, like how would you respond? Or they give you ethical scenarios, and then you have to come up to a response with right on the spot. So that's a great opportunity to take advantage of as well. And then our staff advisors do teach a number of pre-health courses. Unfortunately, due to COVID-19 and associated budget cuts, they won't be offered this year or next year. But for those of you who are first or second years, you can take some of these courses during your third or fourth year. And so SEM 101 is Intro to Health Professions, which for most of you, if you're set on pre-med, that probably wouldn't be the greatest start. But Bio 253 is a shadowing class, and that pairs you up with a local physician or provider for the quarter. And so you get to shadow them and reflect on your experiences. And then other classes include service learning in the health professions, application development, and a public health internship. So keep an eye out for those in 2023 and 2024.
Okay, and so lastly, we just wanted to list some contact info for you in case you have any questions or want to schedule a meeting or just attend our drop-in hours. So our email is at the top, prehealth@calpoly.edu, and then we also have our phone, our website, and then our office, which we're not currently located in because we're doing everything virtual right now. And so Connor mentioned we have our drop-in hours, and those are listed there on the left. And then for planned appointments with staff advising, so especially for those of you who are in the application stage or want to work on your personal statement, those can be also found on our website, and they'll be scheduled via Calendly, but usually you need to book up to 2 weeks out. So definitely plan early if that's where you're at in your application stage and you want to get an appointment.
All right, so thanks for listening. That's all we have as far as presentation today, but we did want to save a lot of time for questions because we figured there might be a lot of them. So feel free to chat or just unmute yourself and ask. And I'm going to say that as far as the question that Thomas had about credit, no credit classes for major coursework that aren't prerequisites, the short answer is yes. There's more to it though than that. The one part of that is you want to check with your major department. Each major department has different rules for what they will permit for credit, no credit classes in the major. So do check with your major department. If you are a College of Science and Math major, then for the fall term, you can do any of your major or support classes or GEs, credit, no credit. That is likely to change starting in winter, but I don't know for sure yet. So stay tuned or ask questions if it comes up for winter, but for fall, credit, no credit for major classes in the College of Science and Math are okay. If you are from a different college, I don't know because I don't keep track of all of the other majors. And so you'll want to check with your major department to see what allowances are permitted for credit, no credit in major coursework. The second aside to that is if you are a science major and taking a class, credit, no credit, that's a science course that is not a requirement for medical school. What I will say about that is it's okay. And again, the short answer is yes. But what that means is because of the way that GPAs are calculated, the more classes you have in a GPA, the less impact each individual course has. So like if you make a C in a prerequisite, say you make a C in like Chem 127, but then you later, and say you're a chemistry major, then later on in your academic career, you've like adjusted to being in school and virtual learning and wherever we're at the time, but you've adjusted and you've improved your grades as a biochemistry major and you take like physical chemistry, not a requirement for medical school, right? But it is a requirement if you are a chemistry major or a biochemistry major. Then, and say you do really well in physical chemistry, that grade will offset your overall GPA and your science GPA. And your science GPA is looked at schools or looked at by schools. And so it is helpful if you're doing well in your other science classes to do them for a grade. In general, I recommend to do a class for a grade if you're making an A or B. Even if like you're used to making straight A's and this is going to be the one time you make a B, still do it for a grade because it's still going to like give you the chance to show that, hey, you can do classes and in a virtual learning environment and still make A and B grades. Oftentimes credit and no credit grades are going to either be seen as C's or they might even be calculated as C grades. So you really only want to do things credit, no credit if you're going to be making a C grade or lower. But yeah, any other questions? I know that was a long aside to that, but there's just so much more to that question than just the yes or no.
For some of our younger students, could you talk a little bit about maybe like pros and cons of picking a track in biology, or like if a nat and phys is helpful or looked at by schools, or if it's just more personal preference?
Yeah, good question, Julia. Thanks for asking that. So yeah, your concentration is much like your major. So your major doesn't matter for medical school, and neither does your concentration if you're a biology major. So, and if you're a different major, your concentration isn't necessarily going to matter either. I will say for other majors, sometimes it is beneficial as far as prerequisites go to do a particular concentration, and you'd want to have a conversation with your major advisor or Connor or Jacqueline or myself about that. When it comes to biology though, all of your prerequisites are part of your major. So you don't need to worry about choosing the right concentration because none of the concentrations cover any of the prerequisites for medical school. All of the prerequisites are in your major core, your biochemistry, organic chemistry, physics, math. The two concentrations that are the most common for pre-med students who are bio majors are general and anatomy and physiology. That said, and third would be molecular and cellular biology. That said, we do have and have had students in the past major in, we used to, before we had the marine science major, we had a concentration in marine science, and students would do the marine science concentration along with their pre-med prerequisites because they saw it as like their chance to, you know, explore a different area of biology that was also equally fascinating to them as medicine, and they knew they weren't going to be doing that in med school, so they did that as their concentration. So it's really up to you. Your concentration, like I said, is like your major. Med schools do not care what your concentration is. They aren't looking for any particular name of a concentration. So doing any of the bio concentrations is totally acceptable. And you can do the prerequisites with any of the concentrations. If you want to do anatomy and physiology though, because you want to take the anatomy and physiology courses, that's great. Taking the anatomy and physiology courses is not required for medical school because you do anat and phys in medical school and you do a lot of it in medical school. But when students take the anatomy and physiology courses at Cal Poly, they often feel very prepared for anatomy and physiology in medical school. So it's definitely has its advantages, but it's not a requirement by medical schools, and it's not going to make you more competitive to schools. It will just make the understanding of anatomy and physiology in medical school come a little bit easier and quicker to you because you will have seen it before. But medical schools aren't going to be like, oh, this student majored in, or concentrated in marine science, and this one concentrated in anatomy and physiology. Let's choose the anatomy and physiology student because they're going to come in already knowing this information. They're not going to consider that one little bit. What they will consider is they might ask you an interview question that's, why did you choose the concentration you chose? And if you say, I chose anatomy and physiology because I thought I needed it for, like, because I'm pre-med, and so like that was the thing to do, that's not a very well-developed answer. So you really want to think more about like why you're choosing that. Like, I'm choosing it because my advisor said that these classes are really great preparation, and I was really excited about taking anatomy and physiology, and at Cal Poly they have human cadavers in the anatomy and physiology labs. And I was really excited about taking those classes. And I just wanted to get a head start on medical school and like developing my understanding of those areas. So that's why I took those classes. Or if you decide to concentrate in the biodiversity concentration, since the marine one doesn't exist anymore, that's the closest thing. You know, you would say that you were interested in those areas of biology, and this was your opportunity to learn more about that before you start medical school. And I actually have heard a couple of physicians describe human biology in this way when it comes to, like, oftentimes I think it's really easy as a biology major to be like, oh, those ecology classes, like, I don't need that. It's not relevant for medical school. But if you think about the way that our physiological systems work with each other, that's very much an ecological system. Like our physiologies are different ecology systems. And so learning and thinking in that way, yeah, you're applying it to like the greater world, not an individual human, but thinking in that way can certainly be another perspective when you then learn anatomy and physiology, to think about how all of these physiological systems are not operating in vacuums and interacting with each other and influencing each other. So that was a long answer to that question, Julia, but I thought I'd use it as an opportunity to talk about some other things too.
No, that was really good. Thanks for answering that, Megan.
Yeah. To declare a concentration, there is a link on the CSM advising website under the FAQs. You do an Adobe form. It's an electronic signature with your email, Cal Poly email address. So if you go to csmadvising.calpoly.edu and go to the FAQs, there's a link for it there. I'm going to put it in the chat right now. But that's how you declare it. I wouldn't recommend, if you're a first year, declaring your concentration just yet. The entire first 2 years of the biology major are the same regardless of concentration. So I would give yourself some more time to really chew on it and think about what you want to do. Yes, you can still get involved in the cadaver lab without having an anatomy and physiology concentration. We have students who are not even biology majors who get involved with the anatomy and physiology lab. We've had biochem students, kinesiology, public health majors get involved with it. So yes, definitely just talk to, I think it's Mike Jones who is the coordinator for getting involved in the lab. They do want you to have taken anatomy and physiology. So if you're going to do like the general concentration, you'll still want to do the anatomy and physiology courses in preparation for getting involved with the cadaver lab, or if you're a non-biology major, the bio 231 and 232. But if you talk to the faculty teaching the anat and phys courses, they'll get you squared away with being on the wait list to get involved. You're welcome. We'll stick around. I mean, we don't have things that we need to run off to. So if you're still thinking of your questions, that's fine.
Yeah, thank you guys. We can keep doing questions, but thank you all for coming. We got a big team, so it's really great. Good to get you all introduced to everyone, even though we're virtual.
Yeah, thank you for having us, Emily, and thank you everyone for being here. And the virtual environment is certainly challenging when it comes to connecting. And I will say that, like Emily said, we have a big team, and it's not just us. You have a big team of supporters at Cal Poly, and while in a virtual environment, it's more challenging to connect. Everyone, I think, is really seeking that, whether they're a student, staff, or faculty. And so don't hesitate to reach out.
Yeah, so if anyone has any other questions, feel free to put those in the chat or unmute yourself. I know our officers will always stick around too if you have other pre-health other unrelated questions besides pre-health advising. I think Dr. Egan is still here too, so if you have any questions for him, we're all ears, basically. But also, if any of you need to get to other classes, thanks for coming, and we'll see you all next week.